Welcome. Today I'm joined by Dr. Ollie Hart, who is the co-founder and director of Peak Health Coaching and Consultancy, I think it is, based in Sheffield. So welcome, Ollie.
Hi, Linda. Thanks for having me.
So it would be really helpful, I think, if you could give us a bit of an intro into Peak Health Coaching, why you set it up and what its purpose is.
Yeah, thanks, Linda. So Peak Health Coaching was established 7 years ago by two of us. We co-founded it, two GPs. And it was really on the back of noticing that from our 40 years of combined general practice, that what seemed to make the biggest difference to people's health outcomes was the role they played in it themselves. So how they built their own personal confidence and their own personal skill set to, either prevent things or treat things when they had them, particularly long-term conditions. Tim Williams and I, who set it up, we both worked in the pain clinic together. And that was a particular area. You're seeing people living with chronic pain. And we noticed that the ones that did best were the ones that we could teach to be more confident, more skillful in looking after themselves. We didn't realize at the time, but that's health coaching. And that's how the company grew, out of realizing this is something the NHS really needs to do.
Because lots of people in the NHS say, well, we don't have time. We're on this treadmill. We've got so many people coming at us that need our help and support. How would it benefit them to learn how to coach, do you think? Or do you know? I'm sure you know.
Yeah, absolutely. Well, I mean, it's interesting, isn't it? None of us have any more time than anybody else. What we have to decide with our time is how we're going to use it. And working as a doctor, I was continually having to decide in my 10 minutes, what would I do? I could prescribe a medicine, I could refer somebody to a specialist, or I could spend a bit of time asking people questions to explore where they're at, what matters to them, and then perhaps try and build up the case for them, developing some more skills themselves. And there will be time and a place for everything. But what we realized was that we were very good at prescribing, and we were very good at doing very medicalized things. We're not very good at advocating for and delivering coaching in the NHS. So everybody has a role to play in that. So as a GP, perhaps my role is to recognise when it would be important that the person takes more of a role in their own healthcare, living with chronic pain, type 2 diabetes, chronic mental health issues, most long-term conditions. And if I recognise that, I create a balanced feedback to the person where I say, well, actually, there could be some medicines that could help here. Actually, but there's a big part we could do in supporting your skills as well. And that's probably really important in what you do. So I might advocate for it, and I might ask a few questions and get them thinking, but I'm likely then to connect them up with somebody that's got more time to take a proper coaching approach with them. Someone like a health coach who might, have 6 sessions, maybe an hour long, 45 minutes, an hour, they can really use coaching skills to take the person, into a place where they feel much more confident, much more skillful looking after themselves.
Because I think the biggest challenge isn't it, that everybody's different and everybody needs to manage their lives in different ways. So how would a coach, or how do you train someone to be an effective coach in that kind of context?
Well, it's a really good question, that, because to train a coach currently in the NHS, the gold standard is 4 days. So 4 days of basic coaching, and then a health coach will go into a system with ongoing supervision and support, and they develop and build their skills. And that's what the NHS has put into its framework. And that's what we do at Peak Health Coaching. Mm-hmm. And I think it's actually very doable. It's surprising, really, that because the essence of coaching is you're not telling someone what to do. So you don't have to build up a whole bank of knowledge around what to tell someone. You need to just learn the skills of how to help people connect with what's going to work best for them. And they're pretty generic skills. And really, they build on a mindset. You have to believe that the person can find the solutions and can lead the solutions themselves, given the right support. And that, like I say, plays against just thinking the best thing to do is to tell them what to do and to find the solutions for them. So you've got that mindset, you have some basic core training, and you get going with it. And it's improving to be very doable in the NHS. Those people who work as health coach then also needed to be supported by a whole system that gets that approach and values it. So we spend a lot of time as well teaching, the wider team, so GPs, nurses, pharmacists, physios, to have a coaching mindset and to value it and to do the bit they need to do to create that culture in the NHS.
Presumably a health coach can come from many different backgrounds.
Absolutely, they often do. And actually, often a health coach is really good. The best health coaches come from people with lived experience. So, for instance, we're teaching people in pain management, so where we started, and we are bringing on people with lived experience of living with chronic pain, who learn the coaching principles and the coaching mindset, and then they draw on their own experience alongside coaching, and it's a really valuable combination. So yeah, patients, but also people come from, often from the voluntary sector, from social sector, from, having had roles as community connectors or community builders. They often have that mindset of valuing the role the person takes.
Yes, it's interesting, isn't it? How sometimes if you can open a door for somebody to enable them to tap into their innate abilities, they grow and blossom and do a much better job. I was talking to somebody at our graduation ceremony on Wednesday this week, and she was saying how just doing an education course opened so many more doors to her. And yet, actually, when you have the knowledge, you also need the know-how, don't you? The ability to translate that into practical day-to-day support for people.
You do, absolutely. And I think it's interesting. Here's me talking as a GP. I feel like GPs are a little bit late on the bandwagon, actually. Nurses and occupational therapists and the wider therapy team, I think, have been ahead of us on this for a long time. I think they've practiced in a more person-centered way. They've understood the value of compassion wrapped around somebody and helping them to grow in their own mindset and skill set. GPs have been excellent, I think, at problem solving, and we've been excellent at kind of like understanding the wide scope of information that can support people. But maybe we've been a little bit, we've lent towards telling people what to do. And if we can just redress the balance back a bit, where we use the knowledge and the information we've got in a really helpful way to tailor it to what people need to self-manage better, you've got a really winning combination. And that's what I'm really interested in, is how we perform well as an NHS team. And I think we can do that by taking a coaching approach in the NHS.
Yes, it was lovely to be at your conference recently and to hear of all those people, all the people who were there, how enthusiastic they were, and how many of them, I think, finding that they were able to coach effectively had given them a lot more pleasure than they'd had in a very long time in their roles. So that was really good to see. But if you're someone who's sitting in a health system at the moment where they haven't adopted this approach, and based on the fact that the NHS likes to be very evidence-based, what are the things that you could say to them that would demonstrate the impact of a coaching style and using health coaches?
Yeah, well, I'll just quickly pick up on what you said about the staff there as well, because actually that's been really interesting. You see, people love to practice in the coaching style. I've seen so many of my professional colleagues, nurses, doctors, the whole range, see their careers reinvigorated by taking a coaching approach, because it releases you from the pressure of having to hold everything yourself and solve everything. And you develop a much more interesting and productive relationship with people. And I think people really enjoy that. In terms of evidence, it's really interesting. There's people increasingly doing really good work demonstrating that coaching effects have a massive impact. I'll draw on some work from Southport, the diabetes lead, David Unwin there in GP practice in Southport, where they're using coaching style approaches to build non-medical approaches to type 2 diabetes. And they've seen by, employing coaching styles, particularly peer support, people working together, and focusing on things people can do for themselves with their diet and their exercise, they've got to a point where they've got 23% full remission without drugs for their type 2 diabetic population. So that's 150 people out of his 500 odd people that are now in that category. And interesting, that's only half of those people have engaged with that process fully. So kind of half the ones that engage get full remission. That we're just not seeing that happen in any other long-term condition. In our training process, we are lucky enough to train people and then follow them through for about a year afterwards, where they track what they've done. And we time and again hear case stories where people have worked with people where they're saying that it's the first time I've ever been properly listened to. They tell stories of people gaining confidence. And, you know, one particular one I can remember just recently, they come up all the time. They're not unusual, but, you know, someone who was referred by a pharmacist who was asked to increase their antidepressant medication in this patient. And they sort of thought, actually, well, maybe coaching might be a better way. The coach worked with that person for 6 sessions, realized that they weren't enjoying their job, realized their relationship was a factor, and realized that, you know, they could help them find some techniques in terms of self-management rather than medication. And at the end of those 6 sessions, you know, that they were not increasing their antidepressant. In fact, they were decreasing it. They got a new job, and they were just feeling much, much better as a person. You know, and that was far more powerful than you'd ever achieve by just titrating up an antidepressant medication. And that health coach really found that work meaningful and was describing it in a way where she was just uplifted by that. And I must admit, I'd never been that uplifted by increasing someone's antidepressant medication. You know, I know it's part of my job, and it's something that I do have to do sometimes, you know, but I really appreciate there's a whole load of other stuff we could get good at that complements that or replaces it often.
So are 6 sessions normally the amount of time that it really takes for people to really be able to demonstrate that they're doing things differently and they feel more empowered?
Yeah, well, we advocate for tailored health coaching, where we think, just as you said earlier on, that people are all different, you know, and there are some people who are, you know, really kind of well on their journey. You know, they are already pretty good self-managers, and a health coach might work with them, perhaps just over 1 or 2 sessions to refine their plan. You know, what are you going to do to really make sure that you're managing your diabetes, even when you're eating out or when it's, you know, special occasions or something. And, you know, it's a very niche job you're playing with somebody to make a specific plan. The other end of the scale, there might be people who come to a health coach where they're feeling very nervous about even thinking about engaging with healthcare. You know, they've traditionally seen health management as being something they get told by their wife or their husband or their healthcare professional, and they don't think about it at all. In fact, they're very nervous about opening even the possibility they might have a role to play. And a health coach in that situation, the job, you know, is to create psychological safety, trust, rapport, and it might take longer. You know, it might take 3 or 4 sessions before someone's even prepared to open up and start talking about what they want out of life, you know, and you might work longer, maybe, you know, it could be 12 sessions with someone like that. But interestingly, what the evidence shows, if you can take someone from feeling they haven't got a role to play at all in their healthcare to starting to think about it and taking a lead a little bit, not even maybe doing a great deal, there's a huge knock-on benefit that flows down the line. So, you know, sometimes taking a little bit more time to do the bits that the rest of the system might not have time for becomes hugely valuable for the NHS in the end.
Brilliant. And as you know, I'm really passionate about coaching myself because I've seen the benefits, not just in health, but external to that. So it's been quite exciting that we've agreed to collaborate and offer people the opportunity to do one of our courses alongside health coaching. Could you talk about how you see the benefits of that collaboration?
Absolutely. We're delighted with it, Linda, because for me, the real value in the NHS with this is combining good quality education with the coaching mindset and the coaching principles. You know, you help people to understand what's really going on. I mean, I can talk to pain management, you know, that, you know, there's modern education around pain management that it's really helpful for patients and staff to understand. And you guys are really good at that. You combine that with the skill set to help someone to look after themselves well and to build their confidence and their knowledge around self-management. You've got a real winning combination. So it's very exciting to see these two, you know, really robust organisations fitting together.
No, it is. It's very exciting. We're looking forward to kind of hearing the results when people have been through both programs, because I'm sure we'll find that that they will have all the tools they need in their toolkit to support people in the most appropriate way. So we too are very excited about it, which is brilliant. So thank you so much for joining us today, and hopefully our collaboration will grow and more people will hear about the benefits of actually combining education and health coaching, and we'll start to make an impact. That will be brilliant.
Be lovely, wouldn't it? I really think when the NHS takes on the coaching mindset, there's so much to be won.
Absolutely. Thank you very much, Ollie.
Cheers. Thanks, Linda.